So, if you've ever been in the world of PCOS testing, either for yourself or someone you know, you've definitely heard the term polycystic ovaries. But what does that actually mean when a doctor is looking at an ultrasound? It can sound a little intimidating, a little confusing. Well, in this explainer, we're going to decode exactly what they're seeing on that screen so you can understand the language your doctor is speaking.
You know, getting a diagnosis for polycystic ovary syndrome, or PCOS, it can feel like a really complicated journey, right? There are symptoms, blood tests, and then there's this key piece of visual evidence, the ultrasound. That scan gives us a crucial window into what's going on, but really understanding what those images mean is everything.
And that's the big question we're tackling in this explainer. When a report comes back and it says polycystic, what visual markers are the medical team actually identifying? We're going to break it all down step by step. Okay, so before we zoom right in on that ultrasound image itself, we got to take a step back and look at the big picture. Because that scan, it's just one part of a much larger diagnostic puzzle. Doctors use something called the Rotterdam Criteria. Think of it as a 3-point checklist. And here's the key. A PCOS diagnosis requires checking off at least 2 of these 3 boxes. First, irregular or absent ovulation. Second, signs of high androgens, sometimes called male hormones. And third, the one we're focusing on, that specific look of the ovaries on an ultrasound. So for the rest of this explainer, we're going to park those other 2 criteria to the side and really laser focus on that third point, polycystic ovarian morphology. What is the ultrasound actually showing us?
The fancy medical term for this is Polycystic Ovarian Morphology, or PCOM for short. Now, it's super important to know this isn't a diagnosis all by itself. It's the technical name for the very specific set of visual clues that doctors are trained to look for during that scan.
Which, of course, begs the question, if they're looking for PCOM, what are they actually searching for? And, spoiler alert, it's not as simple as just spotting a bunch of cysts. It's a really detailed checklist.
All right, so let's pull back the curtain and look at the exact same 5-point guide that sonographers and doctors use to identify polycystic ovarian morphology. We're going to walk through them one by one.
First on the list, the overall size of the ovary. One of the main signs of PCOM is that one or both of the ovaries are just physically larger than what's typical. They often describe this as being bulky. And this isn't just a vibe check, it's a hard number. They actually calculate the volume, and if it's greater than 10 milliliters, that's a check mark for this first criterion. So it's not a guess, it's a real measurement.
Okay, point number 2 is probably the one you've heard the most about. It's the number of follicles. But here's a really key distinction. These are not cysts in the way we usually think of them. They're actually tiny immature egg sacs that have started to grow but haven't fully developed. Now this is where things get really interesting, and it shows how science evolves. The original rule of thumb, way back in 2003, was 12 or more follicles. But, you know, ultrasound technology has gotten so much better and can see things way more clearly now. So in 2018, the international guideline was updated to a much higher number, 20 or more follicles. Okay, moving on to number 3. It's not just how many follicles there are, it's also about where they're hanging out. In the classic PCOS picture, all these little follicles are lined up around the edge or the periphery of the ovary. And this arrangement is what creates that famous visual you might have heard of. It's called the string of pearls sign. It's such a perfect way to picture what's happening on the screen, isn't it?
All right, for number 4, we're moving from the edges of the ovary to the very center. The technical term here is echogenic stroma, which sounds super complicated, I know, but it's really just about how the middle tissue looks on the scan.
So what on earth does that mean? Well, on an ultrasound, echogenic just means it bounces sound waves back really well, so it shows up as bright white on the screen. This is a sign that the tissue in the middle is denser than usual, which is another classic clue for PCOM. And finally, our 5th point. This one's a little different because it's about what shouldn't be there. For a really accurate assessment, the scan shouldn't show any single large maturing follicle, which is called a dominant follicle.
And the reason for this is actually pretty simple. If you have one big follicle that's growing and getting ready for ovulation, it can temporarily change the whole ovary's size and shape, and it can kind of mask the other classic PCOM signs. So if a dominant follicle is seen, they might ask you to come back for another scan at a different time in your cycle to get a clearer picture. Okay, so we've just gone deep on that 5-point visual checklist. Now let's zoom back out and see how this one piece fits into the whole diagnostic puzzle. This is probably the most important question of all. If that ultrasound report comes back and it's checking all those boxes for polycystic ovarian morphology, does that automatically mean you have PCOS?
The answer, and you really need to hear this, is not necessarily. Seeing PCOM on a scan is common, and it doesn't automatically equal a PCOS diagnosis.
So, here's the absolute key takeaway. Remember that 3-point Rotterdam checklist? Well, the ultrasound finding of PCOM is just one of those 3 potential criteria. To get that full PCOS diagnosis, you must also meet at least one of the other 2 criteria, either the irregular ovulation or the high androgens. So yeah, the scan is a huge, crucial piece of the puzzle, but it is not the whole puzzle.
And that kind of leaves us with a really cool final thought to chew on. We just saw how better ultrasound machines literally change the diagnostic criteria for follicle count. So as our medical imaging technology keeps getting more and more amazing, you have to wonder, how much clearer is this picture going to get in the future, and how will that lead to even more precise diagnoses?